Okay. Good afternoon, everyone. Sorry to keep you waiting, to keep you here. I would try to make our presentation as quick as possible. So I would like you to look at these pictures. This is Noah. At the age of 4, he was diagnosed with a really deadly type of cancer. And he went through a very harsh course of chemotherapy. That is why he had very pale skin, no hair. And then this is him. And also he did a stem cell transplant to treat the cancer. This is him 3 years later, 2014. He's now 7 years old, cancer-free. For most of us here, it's not a very powerful pictures, but for people who are fighting with cancers, or people who have family members fighting with cancer, this is a very inspiring and powerful pictures. So do you know what type of cancer I'm going to talk about? It is leukemia. So my group 4 will talk about leukemia. So first of all, what is it? What exactly is leukemia? So before we talk about leukemia, I want to talk a little bit about the elements in the blood. In our blood, we have red blood cells carrying oxygen. Platelets, this is the clotting factors. So if you have a cut, this will be the factor that help you clot that cut and you won't die from bleeding. And these are white blood cells, including monocyte, lymphocyte, eosinophil, basophil, and neutrophil. These cells in the blood come from the bone marrow. This is the structure of the bone. As you all know, this is the compact bone, the hard part, the spongy bone, and this is the bone marrow, which homes to many different types of blood stem cells. And each of these stem cells is responsible for producing different types of B cells. So leukemia is the cancer of the body blood-forming tissues, which is the bone marrow. So, and it mainly attacking the white blood cell, affecting the white blood cells. This is a blood smear between a patient with normal blood and a patient who has leukemia, very high number of white blood cells. So why do we need to care about the disease? Why is it important to know about leukemia? Sadly saying, I couldn't find any statistic for Vietnamese, but I could find these statistics for the USA. So someone is diagnosed with leukemia every 4 minutes. Every day, 143 people are diagnosed with leukemia, and eventually 66 of them will lose the fight. Leukemia causes more death than any other cancer among children and young adults under the age of 20. And leukemia strikes all males and females of all ages and all races. It does not discriminate.
Hi everybody. Etiologies. Chemical substance, various chemotherapy or radiation therapy, exposure to high dose of radiation or pensions, smoking, hereditary disease, genetic abnormalities, chromosome 22 superior chromosome producing too much protein called tyrosine kinase. Tyrosine kinase promotes cancer by allowing certain blood cells grow out of control. Chromosome disorders infected with HTLV1 virus. Common symptoms of leukemia. When leukemia develops rapidly in the spinal cord, it will cause the feeling of pain occupies and affect the growth of normal blood cells, so patients may experience some symptoms: fevers, colds, headaches, pain in the joints, is a manifestation of the influence of power destructive in the marrow. Anemia causes in patients with fatigue, weakness, skin becomes quite lifeless. Blood cells are not normal operated, so the patient should be very susceptible to infection. The presence of abnormal lymph nodes in the body, the ability to decrease protein clotting, plus cancer patients prone to bleeding gums. Is a process the one's static and the rest serious weight loss, especially women still find the phenomenon of excessive squinting at the eyes. The expression of leukemias are easily confused with the symptoms of fatigue, common colds, therefore warning signs. And this is an illustration for the sign of leukemia.
Hey guys, so we're going to be the doctors in the future. So it is really necessary for us to know how to diagnose leukemia. Okay? Nowadays, to diagnose leukemia depends on the symptoms. Your doctors may order you to take one or more of three following tests. There are physical examination, blood tests, bone marrow biopsy. Okay? Among the three tests, the first one, physical examination, is the simplest one. With this test, your doctor may look for signs of leukemia. For example, here is the illustration of one. Here's the illustration. Okay, as you can see, this hand on the left belongs to a woman who has a health skin from anemia. In comparison to the normal hand of her husband, okay? And in this picture, as you can see, there are three swollen lymph nodes right here, all right? This is the symptoms. There are some common symptoms of leukemia, okay? About the blood test. Maybe by just basing on the result of the physical examination may not be enough for a doctor to replicate if you have leukemia or not. So blood tests are necessary. By looking at the sample of your blood, maybe your doctor can determine if you have abnormal levels of white blood cells or platelets. Okay, and even if the blood test suggests that you have leukemia, your doctor may order you to take one more test. It's bone marrow biopsy. Do you know what is bone marrow biopsy? Do you know? Okay. Bone marrow biopsy is a procedure where a small amount of bone situation to diagnose leukemia, doctor usually take the bone marrow by inserting a needle into the breastbone or pelvic bone. Okay, and if leukemia cells are found in your sample, maybe your doctor will ask you to take more tests such as X-ray, X-ray chest, MRI of the brain, and so on. So for them to make sure that for them to create a suitable treatment plan. Okay. Oh, that's it.
The classification of leukemia depends on two aspects: the speed of the cancer development and the origin of the cancer. First, if the leukemia progresses slowly, it's called chronic leukemia. On the other hand, if the leukemia progresses rapidly and requires immediate treatment, it's called acute leukemia. Second, if the cancer originates from myeloid stem cell and so it's called myeloid leukemia. And if the cancer comes from the lymphoid stem cell, it is called lymphocyte leukemia. As a result, there are a total of 4 broad classifications of leukemia, including acute myeloid leukemia, acute lymphoid leukemia, chronic myeloid leukemia, chronic lymphoid leukemia. Because these types have different characteristics and require different approach for treatment, it is extremely vital to identify the type of leukemia that the patient has. Let's go into the details now.
Good afternoon, everyone. So here I will tell you about the acute lymphocytic leukemia, ALL for short. ALL occurs more often in children from 0 to 14 years old, accounts for 60% of cases. Most common of childhood with a peak incidence at 2 to 5 years of age. Also, it occurs more common in males. It is a rare leukemia is a rare cancer. It accounts for 0.3% of cancer diagnosis. Let me tell you about what happened. What happened when you have leukemia? So, in the bone marrow, we have stem cells. Blood stem cell. It will develop into blood cell, which will help we continue our living. When blood stem cell have some problem and it develop into some mutated stem cell. In acute leukemia, it happened in those stem cells, which are immature stem cells, or we can call them With the blast, they should in a way they should develop into lymphoblasts and then into white blood cells or into red blood cell platelets. But with the leukemia, mutated stem cell cannot continue its development. So it's stuck at this stage, cell stage. So it cannot be mature. So it won't have its function. One more problem. If it just don't have the function, it's not a big problem yet. The main problem here is that when these cells are mutated, they start growing, dividing non-stop and uncontrollable. So we will have many of these mutated cells, and they will have the bone marrow very thick, and they will use all of the food, all of the things that other cells need. So all we have here is mutated cells, and the good cells are very little, very small amounts of the good cells. That will lead to. So I will tell you a few things that will progress rapidly, and lymphocyte is about lymphocytes, which are B cell and T cell. And in B cell ALL, there is a translocation of T here is for translocation. The translocation between the chromosome 12 and 21 usually occur in kids, and translocation between 9 and 22 is in adults. But the T12 and 21 is responsive to treatment, so it's more easy to treat that kind of leukemia. And about the T cell ALL, this is more common in teenagers. And T cell ALL, when they have to move through the thyroid, and stop there. When they stop there, the thyroid become more bigger, and that will lead to some serious cases. And one more thing, if you ever wonder if there are two mutate chromosomes, first is the mutation that make the cells cannot mature, and the other is the mutation that make the cell divide many. So what happened here is that there are two chromosomes. They translocation with each other, which create two mutated chromosomes, and these two chromosomes, which are mutated, will lead to those problems here. And there are some additional Down syndrome. You all know about it, right? And Down syndrome is we have the trisomy 21. And in chromosome 21, we have some protein that will damage the gene, the ADN. So when we have 3 instead of 2 21 chromosomes, that will create more protein that can damage our DNA. So it will lead to easier to enter AOL. So the AOL here has some symptoms. First is anemia. Anemia is the loss of blood. So it will lead to fatigue, loss of appetite, shortness of breath, pale, etc. The next one is prolonged feeling of bruising, etc. And when you don't have much, that's what happens when you don't have much platelets. When you don't have enough white blood cells, it will increase the frequency of infection. And when you lost appetite, you fatigue, you don't want to eat, and you lost some weight, and your muscular will weak. And as I said before, when the T cell into your thymus, it will be thicker and bigger, then it will compress your airway and your esophagus. Here is the picture. Two pictures. The first one here is a blood smear, which is normal blood smear, and these are lymphocytes. As you can see, there are many abnormal blood cells and just a small amount of lymphocytes. But here is the ALL. You can see that the number of mutated sites increase very much. And the next one is AML, which is acute myeloid leukemia. It also called acute non-lymphocytic leukemia, AML, and it occurs more common in adults, more common in males, just like the AOL. There are various types of post-myelogenous cells, so there are many types of AML. And what happened in AML is that chromosome stress reduction, just like the previous one, and it will create fusion proteins that will lead to differentiation of breast, or we can understand that the myeloid differentiation was inhibited. For example, in acute from myelocytic leukemia, there will be a translocation between chromosome 15 and 17. Here are some kind of AML. You can see here. These are the name of the sign of the cell in the previous introduction.
Now we're talking about chronic leukemia. Chronic leukemia is a blood cancer that develops for a long time. It is generally harder to cure than acute leukemia. Chronic leukemia is divided into two types: chronic lymphocytic leukemia (CLL) and chronic myeloid leukemia (CML). CLL is cancer that affects a type of white blood cell called lymphocyte. Lymphocytes help your body fight infection. They are made in bone marrow. If you have CLL, your body makes an abnormally high number of lymphocytes which forms morphology that are not working right. And more adults get CLL than other type leukemia. It usually grows slowly, so you may not have symptoms for years. And look at this picture. We got stem cell, and then it developed into lymphoid stem cell, and then lymphoid blast. And the last one, it is divided into two types.
invade germs such as bacteria, viruses, and fungi by maturing into plasma cells, which makes protein called antibodies. And these antibodies attack to the germs, which help other white blood cells to recognize and destroy them. B cells are also the cells that most develop into CLL cells. Okay, and the next one is the causes of CLL. Doctors do not know what causes CLL. You are more likely to get it if the first one, you have a parent, sibling who has CLL. Secondly, you have middle-aged or older. The third one, you are the white man. And the last one, if you were exposed to Agent Orange, a homicide was used during the Vietnam War. The chances of getting CLL may also be higher. And symptoms of CLL are fever, fatigue, night sweat, weight loss, shortness of breath, and enlarged lymph nodes and spleen. And the second type of chronic leukemia is CML. It is a cancer that causes an uncontrolled growth of immature cells that should have developed into a certain type white blood cell called myeloid cells. The disease cells build up in the bone marrow and blood. CML affects older adults and rarely becomes children. CML tends to affect males more than females at the age of over 50. And CML is a rare disease. It accounts for a rare 0.03% of all cancer diagnosed. Look at the picture. You see that this is the chromosome 9 and chromosome 22. The part of chromosome 9 goes to the chromosome 22, and then the part of chromosome 22 goes to the chromosome 9, and then it creates the chromosome 22 with a shorter type than normal, and it is called Philadelphia chromosome. And this Philadelphia chromosome is fighting leukemia cells of more than 90% of patients with CML. And CML has a lot of symptoms. When we got chronic leukemia, it means our white blood cells is increasing, will increase uncontrollably, and it causes infection such as fever, headache, fatigue, and weakness. And when white blood cells increase, the red blood cell and platelets decrease, which cause anemia. And people red marks on the skin, pitch. And besides, it also causes enlarged calculus lymph nodes, enlarged spleen. When you got enlarged spleen, you may feel as the mass on the left side of the rib cage. And sometimes you can feel bone pain and a pain or a sense of fullness in the belly. Okay, thank you for listening.
We're actually not done yet, so please bear with me, okay? So this is the most important part. Not the most important, but as future doctor, we should care about this the most. Leukemia treatment. So for ALL, there is 6,000 new cases in 2014, USA statistic. And the main way they treat ALL is chemotherapy. This is how they do it. So the first, it's broken into 3 phases. The first one is induction phase, or also called the wipe-out phase. The induction phase is also called the wipe-out phase. This phase lasts about 4 weeks, and then you will be injected 2 to 3 different kind of chemo drugs. For example, vincristine, asparaginase. And after 4 weeks, depend on how you respond to the chemotherapy, you will go into consolidation or intensification phase, which lasts about 8 weeks. What happens is that in this phase, you will be given a stronger chemotherapy drug. And in the effort of destroying the remaining of cancer cells in the bone marrow, so after the wipe-out phase, you want to destroy the remaining cells so that it won't come back later. After the intensification phase, you will go into maintenance phase, which can last up to 2 years. In this phase, you'll be given weak chemotherapy drug, and in a very long period of time, so that the cancer will not relapse. The other treatment is for patients who have Philadelphia chromosome is TKI, tyrosine kinase inhibitors. Also, some patients may be advised to use radiation if they are not responding to chemotherapy. This disease, the remission rate is about 80 to 90%, which is really high. However, 1/2 will relapse, so they will get the cancer back, which is not very good. So the cure rate for this disease is about 40%. The 5-year survival rate is 85%. Okay, AML, acute myelogenous leukemia. This requires immediate treatment because it is an acute disease. There's approximately 19,000 new cases in 2014. You will go through, the main treatment is chemotherapy, so you go through the same 3 phases. The remission rate for this disease is 65%, and the 5-year survival rate is 25%, which is very low. And the cause of death of most patients is actually high risk of infection, the infections. 85% of death come from the infection. CLL, chronic lymphocytic leukemia, 15,000 cases. And in this, actually, the most used treatment at this moment is TKI, tyrosine kinase inhibitor. You can also use chemotherapy in cycles every 3 to 4 weeks. Because this is a chronic disease, you don't have to treat it right away. You can use low doses of chemotherapy drugs with a long period of time. The 5-year survival rate of CLL is 79%. Chronic myelogenous leukemia, CML, there's approximately 6,000 new cases in 2014. Before the year of 2000, people treated with this disease with interferon, and the 5-year survival rate was 55% before 2001. In 2001, the development of TKI, the most notable is imatinib. This one is licensed by FDA in the year of 2001, and it is used to treat CML, and the 5-year survival rate of patients raised up to 90%. This is how TKI works. As you see here, think of it as a cancer cell. These are receptors receiving signal, specific ligands to tell the cell to do different things, including proliferation, invasion, metastasis, survival, angiogenesis. And when they receive the ligand, the receptor receives the ligand, tyrosine kinase will phosphorylate this domain, and it triggers a signal cascade, which will tell the cell to do these things. So with the TKI, the tyrosine kinase inhibitor, it will go in here, block this. It will block the tyrosine kinase from phosphorylate this. And even though they receive the ligand, these will not be the response of the cancer cell. Another way to treat these cancer is actually stem cell transplant. There are 3 sources for stem cell transplant. The first one is peripheral blood. So the blood is collected from your vein. Using this machine, they will sort out the stem cells and use it as a stem cell source. Or your bone marrow, obviously, or your cord blood. You might have seen movies using cord blood to treat leukemia. Stem cell transplant has had its risk. For short-term risk, you can have mouth or throat pain, nausea or vomiting, infection, bleeding. And the most important one is the graft versus host disease. So what happens is that when you grab the stem cell into the patient, the stem cell recognizes the host cell as the foreign cells. So they actually start to attack every cell in the host body, which can lead to a long-term risk of organ damage and also lead to a graft failure. And if the patient have a graft failure, they will die. So long-term risk, you can have organ damage, you can have relapses because the stem cell can actually contain the stem cell that have the disease already. Or you can also have a secondary cancer. It's mainly lymphoma caused by the Epstein-Barr virus. And one of the most important things also to consider stem cell transplant is infertility. So people who have stem cell transplant will not be, most of them will not be fertile. So for male, you can think about reserving your sperm before you do stem cell transplant. For a woman, you can think of other options like radiation, chemotherapy. And also, one thing to consider to do the stem cell transplant is the cost of it. Each stem cell transplant costs over $200,000. So it's extremely expensive to do this. And most of the company, the insurance company, will not cover this because they think of it as a ongoing clinical trial. So they don't pay for this. And these are our references. So thank you for your attention.